Okay, let's get back in, if we can, to the type O blood. Did you learn anything more in regards to that study, or is it a theory, or what do we know?
So it's really a theory, and what I learned is that I can give you a little bit of the biology behind the theory, which
Yeah.
is that the areas on the human genome that code for blood type also code for other sugar proteins, and it's the sugar proteins that actually cause the or allow the SARS-CoV-2 virus to attach to the cells. And so again, this is getting pretty far down the pike, but there's a belief that there may be a linkage between those things, and it may allow people with certain blood types to allow the SARS-CoV-2 to actually bond more, or in the mirror image to actually bond less. But again, this is all theory.
Yeah.
It actually, the original came from a study where people looked at people who had severe infections and then compared them to the 23andMe genome company. And that's where this first started to come out. And then there were some studies in Italy and in China that were looking at it as well. They haven't published any scientifically reviewed data as of yet. So,
Believe it or not, I am still trying to find my card to figure out what blood type I am.
Way back.
I'm pretty sure I'm O. What am I? I've forgotten
I have
what
no
I am.
idea what I am.
Yeah.
So, Dr. Hall, I guess it would have to be like, if that was possible, that you would be resistant to the virus if you had that blood type, wouldn't somebody have caught on? I mean, do you regularly test the blood types of patients? I mean, theoretically, if you would have had, let's say, for the 20 or the 19 hospitalized patients, at least from Oneida County in the hospitals, if you tested their blood, I mean,
right? Wouldn't it be
like a process of elimination?
Wouldn't it be a simple check to say, okay, everyone who has died or who has been critical in this for COVID-19, none of them have been type O, or only a small number of them have been type O.
yeah, and so the short answer to your question is we don't routinely test for blood type unless we have a reason to. So if we're going to be giving somebody, a blood transfusion or something like that, then yes, we would certainly test for blood type. But it isn't a test that we normally do for everybody who comes into the hospital.
Okay. Well, I don't feel so bad not knowing my blood type then. So I was kind of embarrassed for a second. But
I don't think I've ever known it. I don't know. I did give blood one time, but I don't know.
I guess the long and short of it is if you have a type O blood type and you've had the virus before, I mean, that theory is kind of eliminated.
Right. Or if you had it severely.
Yeah.
And what?
What I would offer there is that nothing is 100%.
Right.
So it could be that it is relatively protective, but as an example, if you have some ifs, if it is indeed protective in some way, shape, and form, that type O blood or people with type O blood have relative protection. However, you're also elderly and you have high blood pressure and diabetes and lung disease. There's a mix of things there. So you could still get a very severe case simply because there are too many factors weighing against you.